Polycystic ovarian syndrome, also called PCOS, is a hormone condition that affects reproductive women. It's estimated to affect 8 to 13% of people assigned female at birth. That's 1 in 10 females in New Zealand. And it's a worldwide lead causer of infertility. Up to 70% of affected women actually remained undiagnosed. So this is when the ovaries produce an excess of hormones, predominantly androgens, testosterone, but it can also be insulin too. So it can start from the first menstrual cycle, but it can be ambiguous and symptoms can come and go or start later in life. So it involves the follicles filling with fluid and developing immature follicles or cysts. The cysts aren't dangerous or painful, and you don't need the cysts to have a diagnosis of PCOS, despite that its namesake. It's a chronic condition, and the ovaries don't work properly because of these cysts. The other significant aspect is that women with PCOS have high risk of other serious chronic health conditions, such as type 2 diabetes, heart disease. They can also be at risk of high blood pressure, uterine cancer, sleep apnea, that's when you stop breathing when you're sleeping, and as we've mentioned, fertility problems, but also pregnancy complications, including gestational diabetes, preeclampsia, and it can impact the pregnancy outcome with preterms or C-section delivery. So PCOS symptoms, with the influence of the high testosterone and the insulin resistance, can affect mood changes, cause acne, oily skin, male pattern baldness, more hairiness, and weight change round the middle. The cause is unknown, but factors that play a role include that the ovaries are producing excess in androgen, the male hormone. There's an extent of low-grade inflammation. There's some genetic links and insulin resistance. The diagnosis involves a criteria, but it's difficult because of variation in presenting symptoms, the differing with age, and changes of symptoms over time. But you need at least 2 of the 3 things: irregular periods or absence of periods, high level of hormones on blood tests, or sometimes that's not seen, so it may be signs and symptoms of high androgen levels, and ultrasound appearance of the cysts, but again, sometimes they are absent. As we mentioned, PCOS is a chronic condition, so it can't be cured, but lifestyle factors such as diet and being active can help manage the symptoms. Also, maintaining a healthy weight is important. Medication-wise, hormonal birth control and anti-androgens can help manage the excess hormones and treat the symptoms of acne, hair growth, or period problems. Metformin treats diabetes, and then fertility treatments such as IVF